I'm going to tell you a story about a woman who did vaginal steaming to help with some conditions that she was having, and she ended up having pretty bad consequences. Yes, that's right. In fact, she got burned pretty badly. This is actually a case report that was written up in the Journal of Obstetrics and Gynecology in Canada. This was a woman who actually sought care at a medical facility, and I think it's important to talk about. You guys know me, by the way. I'm Dr. Jen, practicing family physician, on-air health expert, and video creator. I do daily health videos and all sorts of stuff, and I've done a number of videos on vaginal steaming, some of which you guys have been happy with, some of which you guys have not been happy with. But let's sort of talk about what vaginal steaming, the legacy of vaginal steaming. I think it's super important. I did a video on the origins of vaginal steaming because this is super important. Vaginal steaming may be hip and all hyped up now, but the truth of the matter is it's been hip for a long time. That's right, centuries and centuries. Women have been using vaginal steaming rather, in cultures throughout the entire world to help with medical conditions. And vaginal steaming has really been a part of many cultures for tens and tens and tens and centuries of years, okay? So there is this sort of very strong cultural legacy that comes with vaginal steaming. By the way, I'd like to know, does your people, your culture, your family, do you vaginal steam as sort of a part of a cultural practice that you grew up with? I'm curious, write that in the comments. But what's happened over time, and I would say probably in the last 10 years or so, I don't know if you guys remember, Gwyneth Paltrow wrote in her magazine Goop, she was one to talk about vaginal steaming in a way that made it sort of take off in the West. Now, again, there are people doing it in the West, but I mean, it kind of took off and really sort of made headlines, and a lot of women became interested in vaginal steaming, and also a lot of places, spas, etc., started offering vaginal steaming and also started touting these potential benefits you could get from vaginal steaming. Now, I've done a video on that in terms of, does vaginal steaming really do this, that, and the other? Take a look at that video. And by the way, some of you were happy with that video. Some of you were not happy with that video. So take a look and let me know what you think if you haven't seen that already. But interestingly enough, in this video that I did, and by the way, links will be in the description of this video. I'll also put cards and stuff like that, and in card screens, in all that good stuff. But one of the things that a lot of you have said in comment to that video is you said, well, because I actually talked about some of the risks of vaginal steaming, and let me just mention them, okay? First of all, we know our vagina is self-cleaning, so it does a lot on its own, which is awesome. You really don't need much, if anything at all. The other thing is, we know that if we steam our vagina, it's possible that the pH of our vagina could be disrupted, and that could cause potential problems, okay? The other thing is that potentially there could be burns, which is the story I'm going to tell you about today. Now, I've read the comments for this video over the last few years, and many of you guys have said to me, hey, I don't even know what you're talking about because you can't get burns from vaginal steaming. I don't know how hot the water you're using is. And by the way, I'm glad to hear those comments because it sounds like a lot of people have not been burned. But here's a case report of a woman who did get burned, okay? This video is not to discourage you from doing what you think is right for your body, but it's to inform you about some of the risks versus benefits of the things that we have out there. I always say, talk with your doctor first. Understand some of the risks and benefits. Understand this. So anyway, this is a real case report written up in a medical journal. Again, 62, if I didn't tell you, she is a 62-year-old woman. Basically, this is her story, by the way. It says the patient is a healthy 62-year-old woman of Chinese origin. She presented, which means she came to the medical facility with symptomatic stage 4 vaginal prolapse that had been there for almost a year, about 9 months. Now, if you're wondering what vaginal prolapse is pretty much when something that belongs on the inside comes outside, okay? So it prolapses. Falls out, and different things can prolapse, to be honest with you. A lot of times we see this with the pelvic organs, as in this case, okay? The case report says the patient was reluctant to proceed to surgery, but multiple trials of pessaries, that's a type of treatment that can be used, had failed. So they hadn't worked, the treatments. She had signed consent for vaginal reconstructive surgery because she was uncomfortable and she was also having lots of symptoms. So it sounds like she was kind of getting to her wit's end and things were pretty bad and she needed to do something about it, even though she was reluctant. And maybe she was worried. Maybe she was scared. Who knows? But before the surgery, the case report says she presented to the emergency department with significant, what they describe as serosanguinous vaginal discharge. What that means is sort of like a bloody discharge from her vagina. Okay. She didn't have any pain though. When the medical people talked to her, she had stated that 2 days prior to that, she had tried vaginal steaming in an attempt to reduce the prolapse. Okay. She had followed the advice of a traditional physician, and the instructions she was given were to mix an herbal medicine blend. They didn't know what was in the blend, in a pan of boiling water, to place the pan on the rim of a toilet bowl and then sit on the toilet for 20 minutes. The patient did this. She did this on 2 occasions, so she repeated this on 2 occasions, 1 day apart, before she came to the emergency room. So it doesn't sound like she did it that long, but clearly she did it long enough to need to go to the emergency room, right? So when she gets to the emergency room, she tells them the story. They take a look. What they saw when they took a look at her was second-degree burns involving the cervix and the vaginal mucosa. Okay, so her vagina was burned, her cervix was burned. The good thing is there was no evidence of infection, but she did have second-degree burns. And actually, in this case report, they do show a picture of it. I'm not going to show it here. I don't own the rights to the picture. I just wanted to tell you the story again. You can look this up in the Journal of Obstetrics and Gynecology, Canada. This was from 2019. Yeah, so second-degree burns, cervix, and vaginal mucosa. No infection, thank goodness for that. And the patient was treated for this burn. So basically, she was advised to use like an antibiotic ointment to wrap the area, and she was followed every week to see sort of how she did over time. The good thing is it sounds like she didn't have any infection in the healing phase. And also a good thing, because I would feel like there probably could be a lot of pain with this, but she had no pain throughout the entire experience, which thank goodness. Her surgery that she was supposed to initially undergo was actually postponed until healing had occurred, okay? This is the thing, all right? You know, again, does this happen to most women who vaginal steam? No. Is this rare? Yeah, of course it is. Is this less likely to happen than not having this? Yes, it's less likely. But as I've always said, especially with treatments and remedies that are considered complementary or alternative, we have to sort of really weigh the risks versus the benefits and understand what those risks potentially could be. And, you know, again, not to scare you guys, but it's just, again, to be transparent, you know, it is possible, as we see here, for burns to happen. Now, I'll be honest, this woman did have an unusual situation, okay? She had stage 4 vaginal prolapse, which is not going to be, you know, probably most people who do this. And so who knows how much her underlying conditions played a role in the burns, but the point being is it can happen, and everyone who does vaginal steaming is unique and is different. I think the most important thing to do is to make sure that you're consulting your medical provider. Really, they're the person who knows you best. They know your lady parts down there and what's going on with you, and what things may be helpful and what things may prove to be harmful. And they can also talk with you about your specific risks versus benefits if you are interested in doing something like this. You know, that's honestly the thing I advocate for the most. The other thing I've said in the videos that I've talked about, which, you know, again, a lot of people had a lot of things to say about it, but it's just to understand that, you know, not every treatment or regimen is right for everyone. And sometimes just because something seems or is natural or holistic doesn't actually mean either that it's right for you or that it's safe for you. That's the biggest take-home message that I really want people to have, okay? It's not that you can't be interested in vaginal steaming. It's just that you need to be educated and you need to talk to someone who knows you and your body to help you make the right decisions. So I'd love to know what you think about this video. Let me know if it was helpful, if you knew about this case report or not. I think it's interesting, and I also think it's helpful because there's not a lot of case reports about women having burns after vaginal steaming in the literature. So I think it's important to mention. Let me know if you vaginal steam. Let me know if you've ever had any problems. Let me know what successes you've had with it. If you talk to your doctor about it, all that good stuff, okay? And like I said, take a look at my other videos so you can hear some of my thoughts, more of my thoughts about vaginal steaming. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. If you've not subscribed to my channel, please do and click the link. If you have not subscribed to my channel, I invite you to do so. Also, please click the little bell to get updates live, and consider joining my subscription groups for exclusive content. Guys, let me know what you think, and hope this was helpful.